Okay, so siguro I have to demonstrate it now sa actual naman. So, sino po kaya gusto mong subject? Sir Ian.
Relax ka na.
May skull na pa. May skull na.
Relax na siya, may skull na.
Ayan. If you want, pwede pong lumapit ha. Sir, okay lang po.
Sir, saan ipipin?
Sir, can you hear us? Can you hear us? Okay po. So now, I'll palpate first for the occiput and for the atlas and axis area so that I can have my fingers placed. So, side ko na lang pati Sir Ian. So, nandito po yung occiput ni Sir Ian, occipital protuberance. Then, nandito na po banda yung atlas and axis niya. So, dito ko na po ilalagay yung fingers ko. So, all 4 fingers. Yung thumb naman, resting lang siya dito. So, make sure that when we start, the head is relaxed. So, sir, relax lang. Then, I will try to meld with the tissues. So, I will be adding 5 grams of force. Then, I will wait for that time that the tissues will parang join forces with me, with my finger. So, parang ganun. Magre-relax siya with my finger. Ano ba yung feeling na relax? Yung feeling na relax, parang wavy yung feeling niya. It feels like wavy na parang malambot na siya talaga. So, as I mentioned a while ago, it takes time before tissues really react. But if you try to poke immediately, for example, not applying 5 grams of force, ano mangyayari sa muscle? It will react back. So, ano mangyayari? Hindi po siya masyado magre-relax. So, I'm just waiting for it to relax. Minsan, may mga mararamdaman po tayo dito. How do we know that the tissues are reacting? Minsan po, may mararamdaman tayong sobrang init na pakiramdam between the fingers and the skin of the patient. Or minsan, may mararamdaman po tayong mga throbbing as if may mga pulsations on the area. Tandaan po natin ginagamit yung thumb natin. Di ba usually, we have pulsations on the thumb. But here, we're using the 2nd and the 5th fingers. But, at times, we feel pulsations. Anong ibig sabihin po kapag umiinit or kapag may mga pulsations? It means that the tissues are in the process of reacting with us. So, it tells us that we should not proceed to the next step. We only proceed to the next step if those let's say the heat or the pulsations disappear. So, sila yung isa sa nagsisignal kung kailan po tayo magpo-proceed sa next step. So now, ang nararamdaman ko po, mainit po. I don't feel any pulsations, but increase in warmth, especially on my right little finger and right 4th finger. Doon yung mas concentrated yung mainit. So, I cannot proceed to the next step at this point. So, I really have to wait. According to the craniosacral therapy practitioners, what will happen if you immediately proceed to the next step without waiting for these signs of reaction? So, they say, if you proceed to the next, tissues will have an adverse reaction or tissues may react badly. Pwede siyang mag-elicit ng pain. Yun yung sinasabi ng mga craniosacral therapy practitioners. So, that's why we have to wait for it to really relax. Now, nababawasan na po yung init on the area. How sure am I na hindi lang siya nanggagaling sa weight ng head ng subject ko? Kasi baka sabihin natin, yung init na yun galing lang sa weight ng head ng subject. Equal naman po yung weight na nararamdaman niya on both right and left. However, increased or more warmth is being felt on the left side. Ngayon, nawawala na po siya. Maybe signals me na pwede na ako mag-proceed sa next, and actually medyo malambot na nga yung mga tissues on the area. So to proceed to the next, I will have to flex my MCTs. Take note, kung papansin nyo, hindi pa po nagka-coming contact yung occiput ni Sir Ian sa palm ko. I will have to wait for that. Sir Ian, pasabi lang kung may masakit or kung nahihilo lang. So, I really have to wait for that. Another thing po pala, pag ginagawa po natin to, make sure na kapag cut po tayo ng nails. Kasi pwede pong sumakit, pwede siyang masakit. So, yun lang po. So, now we're doing the second part. So, naka-flex lang po yung finger ko and I'm just waiting for the head to relax. Dito naman, ang signal natin is kapag nag-in contact na yung occiput niya sa palm ko. And I told you, medyo matagal po siya, kaya kailangan supported ng forearm. Sige, anyone can feel for the occiput, kung may space pa o wala na. Ngayon, nag-come in contact na po yung occiput niya sa palm ko. However, kailangan ko pantayin ng konti, kasi not fully pa. Not fully in contact pa sa palm ko. So, I still have to wait more. And nararamdaman ko po, lumalambot na rin yung tissues. So they are relaxing. So what's the next step po after this? Malapit na po kasi tayo doon. Forward yung away from me yung second and third and fourth and fifth towards me. So away from me, and I'm just trying to add 5 grams of force. The first time I did... yes, sir.
Sir Ian, just wanted to ask, yung breathing mo ba is changing while you're doing that?
One sign pa pala yun.
Ano po? Paano po ang breathing, sir?
Did you observe any change with your breathing?
Mas mabagal po.
Mas mabagal daw po, sir.
Okay.
Sorry, I forgot to
Kasi
mention.
sometimes yung suboccipital release, nagre-release yan once na yung breathing mo also would change.
Yes.
Once you're more pragmatic in breathing in nature, mag-let go yung suboccipital. So, really to wait and feel for the muscles letting go, to be patient. That's one important cue. Kasi minsan titingnan nyo rin yung abdominal muscles or abdominal area. When it starts to become more diaphragmatic rather than chest, that's a really good indication that you're going to that point that it's going to release the suboccipital muscles, because there is a big correlation between the two, breathing and suboccipital postures. So,
yes. Aside from what Sir has mentioned, ano pa po, aside from breathing, meron pa pong isang sign pa pala that we can also try to check. Meron po tayong tinatawag na borborygmus, wherein yung parang nagre-react po yung GI tract. Yung feeling na parang nagkakaroon siya ng parang grrr na tunog, ganon. Grrr. Basta ganun po sa GI tract. Borborygmus meaning the system is also reacting on this technique. So that is also another sign that we can look for. So pwedeng i-report kasi ng patient, parang merong butterfly sa stomach ko, parang ganun.
How do you spell that term?
Borborygmus, B-O-R, so double siya, B-O-R-Y-G-M-U-S.
Thank you.
Borborygmus. Pwede din pala yung increased sweating ng patient, another reaction that we can check. So medyo nagre-react na po si Sir Ian, nagre-relax na siya, and medyo na-disengage ko na rin yung area doon. So, I can proceed now to the next step, the fourth, which is, I will apply some supination on my forearm. Meaning, if I supinate, what will happen to my fingers? They will move away from each other. So if they move away, if they move laterally, I will try to move the muscles laterally. Just a bit. We'll just adding 5 grams of force here. Ayaw natin biglain. So slowly I'm moving laterally. I'm trying to supinate. Actually, for some, pwedeng bumalik. For some, pwedeng nakaganito na rin. For some, mas comfortable pag bumalik eh. Kaya yun. Actually, mabilis nag-react yung muscles ni Sir Ian. However, increase ang temperature on all my fingers. On all my fingers. So, I cannot proceed to the next step. So, I really have to wait for that to subside. However, I feel that the muscles are really reacting. Actually, I'm feeling some throbbing on my left fourth finger. At the tip of my left fourth finger. So that is another sign that I have to check. Maybe we can also check for the breathing. That's why we are here. Check if you can observe any change. Kung diaphragmatic breathing, kung abdominal breathing. What we're looking for is more of a diaphragmatic type of breathing. Nawawala na po. Sir Ian, nilaramdaman po ba kayo init doon?
Kanina po.
Kanina. Ngayon? Sobra, no? Parang nakakapasong init siya, actually.
Opo.
Nakakapasong init. Yun
So,
siya.
stress talaga siya.
So, stress. Feeling ko kailangan ni Sir Ian ng pang-release ng stress.
Ayun.
Lalo na para bukas sa Analab.
Oh, at least tapos na yung healing.
Sir Ian, meron pang init.
Konti po sa right side. Pero yung sa
Totoo.
left wala.
Sa right din. Yung left na wala na eh. Right, lalo na dun sa second finger ko. Dun ang pinakamainit na point.
Yun po sir yung may pain pa rin.
Ayun.
Pero sa left wala.
Sir Ian said na sa left nawawala na daw po yung init, pero sa right medyo mainit pa rin daw po. Alam niyo po yung feeling na nakahawak kayo ng mainit na pot or mainit na kape? Ganon siya. Yun talaga yung feeling niya ngayon. Hindi siya exaggeration, pero yun yung feeling niya. And this is one thing na dapat alam po natin, hindi natin naalisin yung kamay natin. So we have to wait for that. Actually, yung muscles, relax na siya. We're just waiting for that to subside. Medyo bumababa na naman po. Yun. Ang bilis eh, ang bilis bumaba. Sobrang init, biglang lumalamig na ngayon. Actually, I think we're ready to go to the next step na. Kasi nawala na lahat ng signs na sinasabi natin. So for the last step, fifth step, that is now the flexion of the head. So, Sir Ian, nahihilo po ba? Hindi naman. So, if in case, tatanungin nila po yung patient kung nahihilo, nasusuka or something. But we do not do this kapag advanced age na ayaw po natin gawin to. Kapag may mga RA, OA, especially on the area, pag may mga fractures, acute stages, we do not want to do this. So, yun lang po. And usually dito wala na tayong sign na maantay. So, around 1 minute, okay na yun. 1 minute, we will do. But ask the patient, baka mamaya nahihilo na, hindi natin kailangan yung 1 minute. And, tapos na po. So, Sir Ian, kamusta po?
Hindi sir, parang ano, during the...
Sige.
Parang nung ano po, yun nga, yung sa heat. Tapos parang mararamdaman mo kasi pag magre-release na, parang bigla na lang babagsak yung ulo mo. Tapos biglang lalamig yung area.
Stress ka ba?
Hindi, parang hindi nga mabigat yung ulo mo.
Parang lightheaded yung
Opo, pero hindi yung nakakainom yung way na lightheaded.
Wala namang nararamdaman ng hilo o
Wala sir.
anything. Lalo na pagkatayo.
Parang parang mabigat kasi siya kanina. Ngayon medyo.
Parang medyo magaan.
Oh, maganda. Okay.
So sige, try po natin practicein po muna yun. Siguro choose a partner.